Let's be real, just going to therapy alone isn't cutting it. For a lot of men, it feels like a dead end. You go to therapy, you talk about your shit, you still feel stuck. Therapy can help, but as a man in this world, you need a little more than that. Women, generally speaking, can get a lot out of talking about their problems. Our brains operate a little differently as men. We need to use practices, use tools, and stick to them to see results. You can talk about your emotions all day, but you can still be dysregulated, disconnected, and numb. A weekly session with no tools in between isn't enough to change the way you feel or how you live. And let's be honest, most guys were never taught how to feel safe in the first place. Talking about your feelings in therapy is far stretched for some guys. So what actually helps? Nervous system regulation. These are relatively basic tools that I find aren't taught in therapy. None of you are broken. Many of us guys are stuck in a fight, flight, or freeze response. For example, a simple tool that you can use is to first identify what you're feeling when you're in these states. For example, I have a lot of tension in my chest whenever I'm feeling anxiety. Now, some of you will start to have clenched jaws, sweaty palms, fast heartbeat. It's important to identify the signs that your body is trying to tell you when you're in a state of fight, flight, or freeze. Now, what do we do when we identify those feelings? Well, breath work is the foundation of nervous system regulation. So I like to teach my clients that they need to exhale longer than they inhale. That actually has scientifically been shown to activate the parasympathetic nervous system, which is the opposite of the fight, flight, or freeze response. So extended exhales, shortened inhales. So for example, a count of 4 for the inhale, pause for a moment, a count of 6 or 8 for the exhale. Another tool that you can use are somatic based, meaning you just honestly notice the way your body's feeling, kind of like what I was saying before, but stick with that feeling. So just notice and feel the body sensations. Try to stay there as long as you can. It sounds pretty easy. It's hard. It can be difficult, especially for those that have experienced trauma, have ADHD, or just are easily distractible. Grounding is another one. This is essentially just identifying what's going on around you using all 5 of your senses. And can you label everything that's blue that you can see in your visual field? Can you notice the sensation of your foot touching the floor and try to really label and identify the texture of the ground and the warmth or coldness of the floor, for example. So those are grounding techniques. And again, these tools are relatively basic. We need to learn the basics. We need to learn the basics first. Passive therapy, we talk a lot about, the problem of the week. We need to get to a state of emotional literacy as men for us to be even able to do anything with those issues that we're dealing with. What does that mean? We, as men, often suffer, and I'll say suffer, from a thing called alexithymia, meaning we don't have the ability to identify our emotional state. We need to get there first. Most men can't name what they feel, and it's not their fault. We were never taught this stuff. So we need to develop a language around emotion. Can we be as descriptive as possible when talking about the way we're feeling, not just happy, sad, or angry? For example, I use a therapeutic modality called IFS, which stands for Internal Family Systems, where I really try to feel whatever it is I'm feeling and actually have a dialogue with that part. And I ask that part of my body if it needs to tell me anything. Usually I can figure out what I'm feeling through that process. Now that's a little woo for some people, I understand, it was for me too, but that's just a tool that I use and that I can teach my clients to really get in touch with their emotions. A lot of healing can happen without words. Not everybody wants to talk. Therapeutic modalities out there that don't require a lot of talking. Brain spotting and EMDR are 2 modalities I'm also trained in that can help men and women process their traumas and deal with their issues without saying a whole lot of things. A lot of the healing can happen internally. Do I encourage you to have a support system where you can talk freely and be vulnerable with friends and family? Absolutely. But a lot of this stuff happens inside, which leads me to my next point. We need to rewrite masculine scripts. There's a lot of stigma around emotion for men. That is, being stoic is strength. And I want to be here to challenge that idea a little bit and kind of offer a reframe, which is strength equals vulnerability. Strength equals presence. Strength equals resilience, and strength equals self-compassion and self-respect. A lot of guys think if I open up, I'll lose control or I'll be hurt. Can we reframe that in our mind to say, hey, if I open up, that's going to look like courage. So therapy also isn't something that you can just do 50 minutes a week and feel better. You need to integrate and practice what you're learning in the therapy room to the outside world. It's a daily process, reflecting and being intentional throughout the week, doing the hard thing on purpose. For example, let's say you have social anxiety and you are afraid to talk to people, going out and doing those basic things that expose you to the anxiety to, again, desensitize yourself. That's just a basic example of what I mean. So this is the kind of stuff that I work on with my clients. It's what I'll be talking about on this channel. If that's something that you're interested in, or you're feeling like therapy alone isn't enough and that you want something a little bit more practical or supplemental to that, feel free to subscribe. Also comment below, what's one thing you wish therapy had helped with but didn't at the end of the day?